My name is Jessie, and this is my med administration test out. So my patient is James Wilson, and I'll be giving him his 8 o'clock medication. He denies any pain or shortness of breath. He has no acid reflux, so I won't administer any PRNs during the med pass. So I'm going to log on to the EMR. And I'm checking to make sure that I have orders from the doctor for these medications. So I'm going down to my patient here, who is James Wilson, which is my first write of medication, is right patient. I'm looking for James Wilson. And he has an allergy to NSAID, so I'll make sure that he doesn't have any allergies to any of the medications that I'll be giving him. So I'm going to So my first med is hydrochlorothiazide, and I only need one of those. Atorvastatin. I only need one of those. And then he has insulin today. He has NPH and regular. And then since this is a high alert medication, I'll make sure that I have a second check. And then his regular insulin as well. And then he is also getting a flu vaccination today. So now I'm going to dispense these meds. So it's from section C. So this is going to be my first safety check. I'll check each medication with the rights of medication, which is right medication, right dose, 50 milligrams by mouth, right route, right time is 8 o'clock, to the right patient, James Wilson, and then I will do the documentation once I give him those medications. So I have hydrochlorothiazide, 50 milligrams by mouth, so I can put that in my med cup. And the next one here is the atorvastatin, making sure again these 6 rights in my first check, making sure it's the right medication, which is atorvastatin, to the right patient, James Wilson, at 10 milligrams, right dose, right route, 10 milligrams, and the right time at 8 o'clock, which is now, and then I will also do my documentation when I give him the medication. And then I have his NPH insulin here, making sure that it's the right dose, the right route, the right time, to James, the right patient, and the right route, which would be sub-Q. And then I have the regular insulin, doing all the 6 rights again, making sure I have the correct dose, the correct med to the right patient, the right route at the right time. And then my last medication will be the flu vaccine. Making sure that's the correct dose, the correct time, the right medication to the right patient, the right route, and then I'll document that as well. So now I have all my medications ready out of the MAR, so I will log off. And I finished my first safety check by checking all of them to my paper EMR to the electronic. So I'll wash my hands. And if he were to have any pre-assessment medications, I would put those in a separate med cup, but since he doesn't, I'll just put them all in the same one because I don't need to do any pre-procedures before. So now I'm going to draw up my medications. So I'm going to start with the insulin, and his blood sugar was 169, so he'll get a 2-unit extra regular from the sliding scale. Make sure I clean the tops of both of my insulin vials. Open my insulin syringe here, the 27 gauge insulin needle here. So to start, I'm going to inject 24 units of air because I have 24 units of insulin total that will be going into the syringe. And before I do that, I'm going to roll my NPH insulin. I'll just clean it one more time. So he's getting 16 units of NPH insulin, so I'll insert 16 units of air, making sure not to touch any of the medication. So I'll bring my syringe down to 8. Now for my regular insulin, I will take 8 units out. First I'll put 8 units of air into it. Okay, so I have 8 units of regular insulin. Can I have you check this for me?
Good.
Okay. And then I will drop 16 units of NPH insulin to equal a total of 24. This is 24.
Good.
And this is my check with my high alert medication. I'm going to recap this needle. And then I'm going to make the label with my pencil. And I'm going to label it with also 24 units insulin, James Wilson, and the date, which is the 18th, and the time, 8 a.m., and my initials. And I'll set this one aside. And then next I'll do the flu vaccine, and it is 0.5 milliliters. And we'll clean the top of this. Open the syringe. As well as the needle, the 22 gauge needle. I'll inject 0.5 milliliters of air. Okay, I'll do it again. Oh, medication is coming. It's a very low bottle of vaccination here. Okay, I have enough. Then can I do check that this is 0.5? Okay. Put this back. And I'm gonna label this one as well. I'll do the flu zone. 0.5 milliliters. And James Wilson. Date. And the time. And my initials. Making sure not to cover up the important part of my syringe, which is the numbers. Okay. Stuff away. This, I'll do now my second safety check. So I have hydrochlorothiazide, 50 milligrams by mouth daily at 8 o'clock to James Wilson. And then atorvastatin, 10 milligrams by mouth. And then I have the flu shot, 0.5 milliliters. And insulin for a total of 24 units. And then I am ready to go to the patient's room. Hi, my name is Jessie. I'll be your nurse today. I just have a few medications that your doctor prescribed for you. I'll provide you with some privacy quick. I actually forgot my medication cards, so I can tell you all the information about your medication, so I will be right back, okay? So I'm gonna make sure his wheels are locked and he is safe, and I'll be right back. I'm gonna take my medications with me. Do that. Okay, and then I can enter the patient's room again. Hi, I'm back. It's Jessie, your nurse. Like I said, I just have some medications for you. By privacy again. Make sure everything is safe here. Looks like your wheelchair wheels are locked. Okay, and can I have you state your name and date of birth for me? And then if the patient were to have the wristband, I would check the wristband, make sure everything is correct on there, and make sure if he has any allergies, that I would note that. And since he's only allergic to NSAIDs, none of the medication I have for him should affect that. So first I'm going to do my third check here. should be atorvastatin, 10 milligrams by mouth. And that one is correct, so I can open that one. And then I have hydrochlorothiazide, 50 milligrams, which is correct, so I'll pop that one out. And then I'm going to check that I have the right units of insulin still, 24, looks correct. And then the flu vaccine, make sure that's correct, the 0.5 milliliters, which is correct. And then I also forgot I need to grab some alcohol swabs, so I'll be right back again. I'm so sorry, James. I'm gonna make sure your wheelchair goes locked and you're still safe. I'm gonna take my medications with me and I'll be right back again. Hi James, I'm back. Okay. Now I have all your medications ready to go. So I have these two oral medications first. The first one is hydrochlorothiazide. This medication is for your hypertension, and any side effects you may experience, if you have any, will just be some increased urinary frequency. And then I also have atorvastatin. This is to prevent cardiovascular disease and risk of stroke and heart attack because of your diabetes, and also to help with hypercholesterolemia. And if you experience any side effects, they could be anything like mild headaches or occasional rash. And then I also have your insulin here, which is used for your diabetes, controls your blood sugar. Any interactions it has with the other medications is just this hydrochlorothiazide. It may increase your serum glucose levels, but we will keep an eye on that one. And then your side effects for this one as well, maybe injection site pain or redness. And then hypoglycemia, especially around dinner time. And then I just have one flu vaccine, prevents the flu, and any side effects might be any injection site redness, soreness, low-grade fever, headaches, diarrhea, anything like that. And make sure again I provide you some privacy. So are you okay with taking these medications with water? And he said he is. And can you take them both at once, or would you like to take them just one at a time? He said he'll take them together. So I'll give him his water here. He takes his pills. And I'll make sure he swallowed them. Did you get all those pills swallowed? Okay, he swallowed all the medication. I have to leave the room again. Get close. Okay. James, I will be right back. I'm going to grab some gloves quick before I administer your insulin and flu vaccine. All right, James, I'm back again. I'm very sorry I forgot both of those things. I'm gonna provide you with privacy again. And wash my hands again. Okay, now I will do your insulin shot. Is that okay? All right, so I'm just going to put my gloves on quick. Is it okay if we do the injection right in your stomach here? He said yes. So for the test purpose, I'll do it on here, but normally we would inject this sub-Q into his stomach here. So first I'm going to clean the area, the alcohol in a circular motion, in to out. And And I'll let the patient know that there might be a little bit of a poke with this medication. And I'm gonna go in and feel the skin. Feels like there's quite a bit of skin there, so I think I'll do 90 degrees. All right, James, they're just gonna be a quick poke, okay? And go straight in. And inject 1 milliliter per 10 seconds. And pull straight out. And then if the patient were to be bleeding or anything, I would put a Band-Aid on, or any gauze or anything if he were to have any pain or any bleeding at all. And then now I'm going to do your flu shot. Is that okay? And with his insulin, I forgot to state that I would make sure that I stay away from any areas of bruising or any past areas that have been injected before and maybe a little sore. So I just kind of skip those places, make sure to do a fresh area of skin. So now I'm going to do your flu shot here, and I'll just show on the patient where I would put a new pair of gloves on for this medication, but on the patient where I would do his flu vaccine if we were to do it on an actual patient. So if this were to be a real patient, we would do it right in the deltoid here, okay? And then go 2 fingers down from the accompanying process in the deltoid muscle here. And then I would feel around for any warmth, tenderness, any lumps or anything, just to make sure we don't administer the shot anywhere we shouldn't. It all feels okay. So then I'll come over to my injection pad. Now I'll clean again from in to out. And then I'm going to administer his flu vaccine here. Okay, you're just gonna feel a slight poke, okay? It's just gonna go straight in. And then I would administer 1 milliliter per 10 seconds. Hold the skin. Then pull straight out. And then if the patient were to be bleeding or anything, I would then give him a Band-Aid. Okay. All right, Mr. Wilson, are you still feeling okay? All right, I will check back with you in about 30 to 40 minutes to make sure you don't have any pain. Everything is still okay. Is there anything else I can do for you while I'm here? Make sure your wheelchair wheels are locked here. And here is your call light. If you need anything else, let me know, okay? Okay, then I'll clean up this mess here. And too, with my flu vaccination, if it were to be any other kind of injection other than a vaccine, I would aspirate to make sure there's no blood return, but since it was a vaccine, I did not do so. So this is James Wilson. His date of birth is 2/12, and he was admitted 2 days ago with COPD. He didn't complain of any pain today, so I didn't give him any PRN Tylenol. He also didn't complain of any reflux, so I didn't give him any sodium carbonate, and I didn't give him his shortness of breath, medication for any shortness of breath, because he denied any shortness of breath. His vitals earlier today were 148 over 88, pulse was 86, respirations were 16, and his oxygen was 96 And like I said, he denied any shortness of breath. His blood sugar is 169, so I administered 24 units of insulin total. I also gave him 0.5 milliliters of a flu vaccine. And then I also administered hydrochlorothiazide at 50 milligrams by mouth. And then also atorvastatin, 10 milligrams by mouth as well at 8 o'clock. So now I will do my 6th right of medication. And I already told the patient I would be back later, and I made sure he was safe before I left. I'll come back, and I'll make sure that I do all of my documentations. And then here, so I would say so I gave him 50 milligrams by mouth at 8 o'clock, and my initials, and then 10 milligrams by mouth, 8 o'clock, and then 16 units of this, and sub-Q for breakfast. And his sliding scale, I gave 2 units because of his blood sugar level. And then his flu vaccine. Intramuscular. Okay. So that was my 6th right of medication administration. That's it.